Hey guys, it's me again, Betty Jo Miller, your personalized licensed advisor for Medicare and Medicare plans. Recently, the news, the GLP-1 bridge program with Medicare has been passed temporarily. If you've been wanting to take medication for weight loss, it is possible that you might qualify for your weight loss program. So the way that works is you need to go to your provider. It can be your private provider that you've been going to for your weight loss medication, or it can be your primary care physician. And this is designed for people who don't have diabetes or other medical conditions that already let them have these medications that help with weight loss. The GLP-1 medication is strictly for weight loss for the bridge for Medicare. The medications that should be covered is going to be Wegovy, Zepbound, and Fundeo tablet. These medications are covered for weight loss. They have to be approved by the FDA. So if you're currently going to a private doctor for weight loss and you're privately paying for the medication and getting the medication from the doctor, more than likely that's coming from a compound factory, and those medications are not going to be approved. When you decide that you want to move forward with this or talk to your doctor about this, there are requirements. One of them is your BMI has to be above 35 or higher. Another one is that your BMI has to be 30 or higher and have other health conditions, or 27 or higher and have additional health issues. So each category has different health issues listed. Your provider is getting information from Medicare. So when you go to them, you tell them that, hey, I want to be a part of this weight loss program, and do I qualify? Your provider, whether it's a private pay provider or your primary care physician or your other specialty doctor, they will be able to look your information up and say, yes, you may qualify for it. Your doctor does not decide if you qualify or not, but your provider has to send the information over to Medicare so that Medicare can approve it. When they do that, they're also sending the medication order over to your pharmacy. It is not going to be covered by your Medicare Part D. You're not subjected to a Part D deductible for this weight loss medication. Your pharmacy will or may reach out to you requesting your Medicare ID number. If you're on an Advantage plan, we've always told you to put your Medicare ID number up in a safe place, because if it's ever billed, it will be denied. This is a new program starting July 1st of 2026, and I believe it runs through December 31st of 2027. The pharmacy will ask you for your Medicare ID number. Provide it to them, because they need that information so that they can confirm you were approved for the GLP-1 Bridge weight loss program. Once you're approved, your medication should cost $50 for 30 days. I don't know if any of you have already tried to do this weight loss stuff, but that GLP-1 from a compound pharmacy runs about $180 for the first level, and it goes up. So for Medicare beneficiaries, it's going to be $50 if you're approved. I believe that's all I have to say about the GLP-1. If you have questions, call me. I'll go over the information I just said, but you definitely need to schedule an appointment with your primary care physician and let them know you're interested in the GLP-1 Medicare Bridge. Have them send the documentation over to Medicare on your behalf, and then the prescription drug to your local pharmacy that you want to use, and sit back and wait and see if you're approved. And if you do all of these steps, please let me know if you were approved or not. Let me know how it's working out for you. Thank you all so much. Have a blessed day. Bye.